you, Honourable Madam Deputy Speaker. Thank the Honourable Member for his question. Honourable Madam Deputy Speaker, the signing of the MOU on the IP, India Pharmacopeia, between the Ministry of Health and Medical Services and the India Pharmacopeia Commission is a significant milestone in the government's effort to improve timely access to quality medicines for the people of Fiji. India is often referred to as the pharmacy of the world, and it is one of the top nations in the world in manufacturing and exporting pharmaceutical products to over more than 200 countries across the globe. Hence, the signing of the MOU is a significant step in increasing Fiji's access to quality medicines manufactured in India. So the MOU acknowledges the India Pharmacopeia is recognized as one of the global standards for the manufacture of medicines and medicinal products. Fiji is anticipated to benefit from the range and quality of medicinal products that is produced by Indian manufacturing companies. Fiji already imports Indian manufactured medicines, and the MOU will increase the range and types of medicines products we can access at reasonable and low cost from India. The MOU also acknowledges that Fiji undertakes quality assurance for all medicinal products that are imported and distributed in country for use by our people. The Fiji Medicine Regulatory Authority undertakes the assessment for quality, safety, and efficacy of medicines to ensure protection of public health and safety. In this way, the public health safety is protected and promoted by the use of high-quality medicines in Fiji. The procurement and supply of medicine is covered in under a separate MOU between the Ministry of Health and Medical Services and a government enterprise of the Government of India. So any procurement under that MOU will follow existing government procurement laws and regulations. Through this MOU, the Ministry will promote access to quality medicine for our population at a reasonably low cost, leading to savings for our families and the government. This is the first time ever that the Ministry is engaged in an agreement, and we hope to maximize its positive impact for the benefit of our people. Thank you, Madam Speaker.
Thank you, Honourable Minister. I see two supplementary